So we look at the patient's walking, a little bit of balance, and then we'll come back to some eye tests or ocular-motor tests, looking to see, can we differentiate central from peripheral pathologies. If you just focus on my fingers there. So initially I'll just do some cranial nerve tests if you keep your head still. So we'll just follow my fingers from side to side, keep your head still. So I need to see that both eyes will adduct and abduct, and in abduction both eyes can elevate and depress, which indeed they can. So we just ask the patient to follow the fingers through that typical H pattern. And as long as they can do that, then I know the ocular muscles are good and therefore their cranial nerves are good. In this case, the third, the fourth, the sixth cranial nerves. So they're the basic tests for the cranial nerve function, which I do. I don't tend to do the other ones because they're less relevant for me.
Yeah.
Also, I'm looking at smooth pursuits. So this is the ability to follow a moving target with eye movements only. And it should be exactly as it says on the tin. It should be a smooth pursuit of the eyes. And in a young person, there should be no issues. If you're very old, then you might see some jumpy eye movements. And
He's cheating a bit. He was moving his head. I could see him.
Patients always cheat. Never trust a patient. They will always try and sort of follow something. And if there's anything going off behind me, they will be distracted. They will look for that. So you need to say, concentrate on the fingers. Just follow nice and easy, nice and smooth. Not too far out to the sides, or you may generate a little bit of nystagmus in the eyes. And you may want to do ups and downs as well. So vertical and horizontal smooth pursuits. Now, if you see problems with smooth pursuits, that would be an indication of a central pathology. So that's a red flag. Next, we might do something called tracking, where you follow the moving target, but this time turning your head. So moving your head. Now, this is very useful because we're actually asking the brain to override a natural vestibular response. So it gets a little complex here. And you said you want to hear a little bit of physiology, but the vestibular ocular response is that, or reflex if you like, is that as I move my head, the eyes go in the opposite direction. So as Mark is following a target, his head is turning to the left and then back to the right. The eyes should be moving in the opposite direction due to the vestibular response, but we're asking him to overrule that and concentrate on the target. So we're seeing, can the cerebellum and the brain work well to override a vestibular ocular response? And it obviously can. The eyes are fairly stationary in the skull. So we know that the brain is good.
And if he couldn't do it, what would you do about it?
If you couldn't do it, again, that would be a red flag. So I'd say this chap needs neurological intervention. So referral to GP and then MRI and then neurology. It's also a very good test for peripheral vestibular function because it involves head movement. So it's likely to provoke a dizziness in most of your dizzy patients. So typically we might say, okay, follow your head, follow the target with your head. And after a little while, you will probably start to feel dizzy, and so we stop. So we know we've produced a reaction. And if we produce a reaction, that means we can probably give you that at some point for rehab, because it means you're not very good at it, and therefore you will get it as treatment.
So you said after a little while, so how long are you going to be doing this for?
Well, I would probably keep on doing it for, say, up to about 20 seconds or so. And most people would become dizzy before then, if they have a dizziness problem.
Yep.
If they don't have a dizziness problem, you can carry on forever and a day, but you don't learn anything more. You might want to speed it up a little bit as well if the patient's coping well. And again, you could do vertical movements as well. So we're looking, can the brain override the vestibular response, and does it provoke a symptom? Then we would go for saccades, and saccade is a rapid eye movement. Okay, so again, this is a central test of motor function. So we'd ask the patient to look to your left and then right and then left, right. Wait for me, patient. They always cheat. Left, right, left, right, left. And we're looking for a saccade to be immediate and powerful and accurate. Likewise, vertical ones as well. So up, down, up, down, up, down. And I like to give the patient a verbal cue and a visual cue as well, just so they're really clear as to what they're actually going to do.